proper history taking and examination are the key. So at least if you can bring the patient once, because nowadays a lot of people doing online consultation, for them I'm saying that yes, if you don't have the opportunity to examine the patient, do elaborate history taking. Otherwise, it is impossible for you to reach to a diagnosis of a chronic cough. Number one thing here to exclude the red flags. So when we talk about red flags, it's just like other chronic conditions that if the patient is more than 40, or if there is a smoking history, or in particular in cough area, there is exposure to asbestos, you can think about something like malignancy. We are thinking about perhaps associated chest pain. Associated systemic features, we all know what are the systemic features we need to look for: this weight loss, fever, loss of appetite, night sweat. Recurrent or persistent chest infection, this is not going. The patient had several courses of antibiotic, and nowadays people are not restricted to this coamoxiclav or this group of antibiotic or even clarithromycin. They are straight away going to ferropenem, meropenem, this group of antibiotic for even for the or entropenem for the chest infection. I don't know what will happen in few years' time. We will just exhaust all the antibiotics. So you have to be very reasonable. If it is a community acquired pneumonia, or if it is a chest infection just recently developed, and the patient is not responding to the typical antibiotic with penicillin group, you can add the macrolide group and see. Don't just go to this group of antibiotics. Just reserve for the serious conditions. Concerning dysphagia, I mean, in this cases, if there is a GERD from the reflux, there is stricture of the esophagus, or there is problem there, so you can think over it. Persistent hoarseness, what happened with the reflux, there is burning of the vocal cord, and they might have this persistent hoarseness. Now, somebody is coming with cough and this hoarseness. It's not always it is a malignancy. It can be due to acid reflux, but yes, definitely if there is persistent hoarseness along with cough, you have to think about malignancy also, and definitely hemoptysis.